Over 1/3 of Hispanic women are living with cardiovascular disease, and in recent years, their mortality rate has jumped sharply. Now, today, American Heart Association volunteer expert Dr. Johanna Contreras is here to share key findings from a new report and tips on how women can take charge of their heart health today. Dr. Contreras, thank you so much for joining us today.
Thank you so much for having me.
No problem. So tell us more about the new research on cardiovascular health as well as pregnancy.
Okay, so important to remember that the cardiovascular disease is the #1 killer for women. And not surprising, we have seen that it's the #1 killer for women that are pregnant. So we have seen a significant increase in cardiovascular disease during pregnancy, called hypertensive disorders of pregnancy. And remember, when you have high blood pressure, high blood pressure will get worse during pregnancy. You can develop all the way to preeclampsia and eclampsia, all the way to that can cause the death of the mom at the baby. So it's very important that we control the blood pressure, and very important that we actually know if we have high blood pressure. So we have found that a lot of women don't have a prenatal visit before they decide to get pregnant. And it doesn't matter how old you are, it is very important that any woman to consider to have a pregnancy to see the doctor before they get pregnant, so you can know what your risk factors are. You can know your blood pressure, your blood sugar, your cholesterol, your weight. Are you in a healthy way? Can you have a pregnancy? So all these conditions are important to be diagnosed before pregnancy, and to the woman to know what she has before she goes into pregnancy, to be able to be healthy as she prepares for that pregnancy.
So what are the risk factors for maternal heart disease and stroke?
Okay, so if you have any family history of heart disease, hypertension, diabetes, stroke, myocardial infarction, you are at risk of having those problems. So it's important to prevent those. If you have high blood pressure or you develop high blood pressure during pregnancy, you can have a heart attack, you can develop cardiomyopathy, that is when your heart doesn't work properly and doesn't pump enough blood. And when you have cardiomyopathy, you can develop blood clots. Those blood clots can go to your brain, can go to your lungs. You can develop myocardial infarction. You can develop stroke. So it's very important that all these risk factors, that is the blood pressure and diabetes and obesity, need to be controlled during the pregnancy. Any woman that has this factor need to see a doctor and need to be monitored, need to be controlled. There are specific medications that we can use during pregnancy to control the risk factors. So it's very important that these things get taken care of, because what we have seen is women are dying of a stroke, they are dying of infarct, they are dying of cardiomyopathy or heart failure, they are dying of blood clots to the lungs, and those things could have been prevented with a proper treatment. So it's very important that we remember this, and especially that women know this so they can protect their health and their baby's health.
Yeah, and speaking of just women knowing what's going on, what are some ways that cardiovascular disease affects Hispanic women?
So we know that, unfortunately, for us Hispanic women, we have a significant genetic component. So we do know that there is more frequent in our families, in our genetics, that we are predisposed to have high blood pressure. We are more predisposed to have diabetes. We have 40% of women having pre-diabetes and healthy weights. Unfortunately, that is a combination of the lack of access to healthcare and inequities in health. Many women, Hispanic women, unfortunately, the first time they actually see a doctor is when they are already pregnant. So they didn't get a chance to be able to be treated before. We need to have a culture of prevention more than a culture of disease treatment, because many times patients go to the doctor when they are sick. We don't want people to come we want you to come when you're sick, but we want you to come before you get sick. We can prevent a lot of the conditions, a lot of these consequences of the illness. So for Hispanic women, we really want to call them to really take care of their health. I know they have babies, and more important, once they have a baby, a lot of women forget about their health. They have the baby, they focus on their baby, and they forget that it's important that if you have high blood pressure or diabetes during the pregnancy, you're probably going to have it after the pregnancy, or you can develop consequences later in life. So it's very important that these 4 trimesters, what we call it, after pregnancy, a woman can take care of their health and also adopt some healthy lifestyle, that she can do exercise, eat healthy, know your numbers, sleep well, avoid smoking and alcohol, sleep and decrease the stress.
Yeah. Don't miss a video. Subscribe to our YouTube channel today for more Central Illinois news.